Serotonin, melatonin, and niacin are synthesized from what precursor? A. L-tryptophan. B. N-acetylcholine. C. The answer is A. L-tryptophan. Serotonin, melatonin, and niacin are all synthesized from L-tryptophan, an amino acid prevalent in many foods including chocolate, oats, dates, milk, sesame seeds, eggs, meat, and cheese. L-tyrosine is involved in the synthesis of dopamine. Acetylcholine is the neurotransmitter released at the neuromuscular junction, which stimulates contraction of skeletal muscle. Taurine has many biological functions in the cardiovascular, muscular, and nervous systems, as well as others.
Which of the following symptoms would be most likely to present in a patient with a biotin deficiency? A. Thyroiditis. B. Alopecia. C. Nausea. D. Edema. The answer is B. Alopecia. Biotin, or vitamin B7, plays an important role in the health of the hair, nails, and skin. Deficiency generally manifests as alopecia, loss of hair color, brittle nails, and dermatitis. Nutritional intervention may include all of the following except dash. A. Admonishing patients for dietary indiscretion. B. Diet prescription or recommendation. C. Providing specific nutrient supplementation. D. Initiating tube feeding. The answer is A. Admonishing patients for dietary indiscretion. Offering a treatment plan that includes specific nutrient supplementation and a dietary protocol is a normal part of a nutritional counseling and intervention. Initiating tube feeding is only necessary in cases of anorexia or other forms of malnourishment, but is still within normal procedures. Admonishing patients for their dietary choices, however, would be counterproductive to the nurse's attempt to foster trust and willingness on the part of the patient, and so would be inappropriate in an intervention setting. Which of the following conditions is caused by chronic protein deficiency? A. Pellagra. B. Kwashiorkor. C. Marasmus. D. Beriberi. The answer is B. Kwashiorkor. Kwashiorkor is a condition of sufficient caloric intake with severe protein malnutrition, often seen in impoverished areas where individuals must survive on carbohydrate-based sources of nutrition. This results in a severe deficiency of albumin, with symptoms such as edema, ascites, fatty liver, and dermal ulceration. Marasmus is a condition not specifically of protein deficiency but of general starvation, which may be due to lack of food security or to intentional fasting or extreme caloric restriction. Pellagra is a condition caused by niacin deficiency, and beriberi is a thiamine deficiency syndrome with neurological, gastrointestinal, and cardiac manifestations. Which of the following nutrients can cause hypercalcification in soft tissues when consumed in excess for prolonged periods? A. Magnesium. B. Potassium. C. Niacin. D. Vitamin D. The answer is D. Vitamin D. Hypervitaminosis D, or vitamin D toxicity, has been known to cause calcification in soft tissues due to vitamin D's role in calcium absorption and metabolism. None of the other nutrients are as closely related to calcium metabolism, and do not cause hypercalcification in soft tissues when overconsumed. Methylene tetrahydroflate reductase, MTHFR, deficiency results in the inability to perform which of the following metabolic processes? A. Methylation of folate. B. Homocysteine remethylation. C. Methylation of vitamin B12. D. All of these. The answer is D. All of these. Methylene tetrahydroflate reductase, MTHFR, is an enzyme with multiple important metabolic roles, including the methylation of folate, vitamin B12, and homocysteine. MTHFR deletions can result in folate and B12-related anemias and high homocysteine due to interruption of homocysteine recycling into methionine. Which of the following is an essential amino acid? A. Glutamate. B. Cysteine. C. Alanine. D. Tryptophan. The answer is D. Tryptophan. Essential amino acids are amino acids that cannot be synthesized within the body, but must be consumed through the diet. Tryptophan is the only essential amino acid listed. In all, there are 9 essential amino acids. All of the following criteria must be taken into account when establishing daily reference intakes, DRIs, except dash. A. ULs, upper intake levels. B. EAR, estimated average requirements. C. ADI, active daily intake. D. RDA, recommended daily allowance. The answer is C. ADI, active daily intake. All of the criteria listed and AI, adequate intake, not listed, must be taken into account when establishing a daily reference intake, DRI, except for ADI, active daily intake, which is a fictitious criteria. Which of the following is the most abundant mineral in the human body? A. Calcium. B. Magnesium. C. Iron. D. Potassium. The answer is A. Calcium. The most abundant mineral in the human body is calcium. It is primarily stored in the bones and the teeth, and makes up half of the total weight of the skeleton. In addition, calcium is present in nerves, muscle cells, blood, kidneys, and various other soft tissues of the body. What is the formula for calculating body mass index, BMI? A. Weight, in pounds, divided by square of height, in inch. B. Square of height, in inch, divided by weight, in pounds. C. Square of height, in meter, divided by weight, in kg. D. Weight, in kg, divided by square of height, in meter. The answer is D. Weight, in kg, divided by square of height, in meter. In standard units, the formula for body mass index is weight, in pounds, divided by square of height, in inch, the whole multiplied by 703. Which of the following is considered a normal body mass index, BMI? A. 18.5 to 24.9. B. 22.9 to 30.5. C. 16.9 to 22.9. D. 26.5 to 32.9. The answer is A. 18.5 to 24.9. Normal BMI is considered to be 18.5 to 24.9. A BMI below that would indicate that the individual is underweight, while a higher value may indicate that the individual is overweight. The answer is A. 40. BMI values between 30 and 39.9 indicate obesity, while a BMI over 40 could indicate that the individual is severely obese. A BMI over what value could indicate severe obesity? A. 40. B. 38. C. 36. D. 34. Which of the following is a water-soluble vitamin? A. Vitamin B5. B. Vitamin D. C. Vitamin E. D. Vitamin A. The answer is A. Vitamin B5. Vitamin B5, or pantothenic acid, is the only water-soluble vitamin listed. Vitamins A, E, D, and K are all fat-soluble and so should be consumed with fat to be absorbed. Which of the following nutrients delays gastric emptying, increases satiety, and lowers LDL cholesterol by interfering with the absorption of dietary cholesterol? A. Unsaturated fat. B. Soluble fiber. C. Carbohydrates. D. Insoluble fiber. The answer is B. Soluble fiber. Soluble fiber, present in oat bran, barley, nuts, seeds, and legumes, delays gastric emptying, increases satiety, and lowers LDL cholesterol by interfering with the absorption of dietary cholesterol. Insoluble fiber passes through the gastrointestinal tract relatively intact, provides bulk for stool, and reduces bowel transit time. Carbohydrates and unsaturated will not lower LDL cholesterol or delay gastric emptying, though they will increase satiety. Which of the following vitamins will be better absorbed when taken with a meal that contains fat? A. Vitamin D. B. Vitamin B2. C. Vitamin C. D. Vitamin B6. The answer is A. Vitamin D. Vitamin D is a fat-soluble vitamin, and so will be better absorbed when taken with a meal that contains fat. The other vitamins listed may be better absorbed with food, but do not require fat for transport across intestinal membranes, as they are water-soluble. Which of the following is a conditionally essential amino acid? A. Arginine. B. Aspartic acid. C. Methionine. D. Histidine. The answer is A. Arginine. Conditionally essential amino acids are those that can be produced by the body under normal circumstances, but may not be able to be produced during certain situations, such as certain disease states or severe catabolic stress. Arginine is the only conditionally essential amino acid listed. Histidine and methionine are both essential amino acids, while aspartic acid is a non-essential amino acid. Which of the following nutrients has strong antioxidant properties? A. Potassium. B. Biotin. C. Copper. D. Vitamin C. The answer is D. Vitamin C. Vitamin C is one of the body's most important antioxidants. Antioxidants are reducing agents, that is, they themselves get oxidized. Recall, oil rig. Thus antioxidants such as vitamin C are electron donors, able to stabilize the free radicals produced by various metabolic processes in tissues and extracellular spaces. Vitamin E, not listed, is another important antioxidant and is actually more potent than vitamin C. Which of the following substances, produced in the stomach, aids in later absorption of vitamin B12 in the small intestine? A. Hydrochloric acid. B. Intrinsic factor. C. Pepsin. D. Gastric lipase. The answer is B. Intrinsic factor. While all of the substances listed are present in gastric secretions and are necessary for normal digestion, intrinsic factor is the only one that has a direct role in vitamin B12 absorption in the small intestine. Deficiencies in intrinsic factor due to genetic variation or damage to stomach lining can result in pernicious anemia, a type of anemia that is caused by insufficient levels of B12. What enzyme, present in saliva, initiates the digestion of carbohydrates? A. Lipase. B. Protease. C. Pepsin. D. Amylase. The answer is D. Amylase. The digestion of dietary carbohydrates is initiated by amylase, an enzyme present in saliva. This enzyme breaks down long carbohydrate molecules into shorter units such as disaccharides. Lipase breaks down fats and is not present in the saliva, rather it is secreted by the pancreas into the duodenum. Pepsin is a protease, an enzyme that breaks down proteins. This enzyme is secreted by the chief cells of the stomach in its zymogen form, pepsinogen. It is activated by the product of the parietal cells, hydrochloric acid. Note that amylase is also secreted by the pancreas to complete the chemical digestion of carbohydrates into monosaccharides so that they can be absorbed by the brush border of the small intestine. What organ produces the bile necessary for digestion of lipids? A. The stomach. B. The liver. C. The duodenum. D. The gallbladder. The answer is B. The liver. Bile is produced exclusively in the liver. It may then be stored in the gallbladder so that it can be released during digestion of a fatty meal. No bile is produced in the stomach, nor the duodenum. The vast majority of bile is cholesterol derivatives that stick to dietary fiber and are excreted along with the fiber. Thus increasing fiber is, mainly soluble, is an effective way to decrease cholesterol. Which of the following is a necessary cofactor for the production of collagen? A. Thiamine. B. Vitamin D. C. Selenium. D. Manganese. The answer is D. Manganese. Manganese, found in oats, brown rice, chickpeas, and spinach, is a cofactor for the enzymes that produce the amino acid proline. Proline is essential for collagen shape and integrity, and is an amino acid, not a cofactor. Other important minerals required for collagen production include copper, zinc, vitamin C, and iron. Which age group has the highest risk for physiological changes due to malnutrition? A. Over 72. B. 12 to 24. C. Over 60. D. 1 to 18. The answer is D. 1 to 18. Children ages 1 to 18 are at the highest risk for physiological changes due to malnutrition. Significant nutritional deficiencies at this age can cause failure to thrive, stunted growth, long-term brain damage, and increased incidence of cardiovascular and metabolic disease later in life. Which of the following minerals must be supplemented in a patient who is on a long-term laxative prescription? A. Calcium and potassium. B. Manganese and selenium. C. Magnesium and chromium. D. Zinc and copper. The answer is A. Calcium and potassium. Prolonged laxative use can lead to hypokalemia and hypocalcemia. This is due to alterations in gastrointestinal absorption and excretion of potassium and calcium. Magnesium can also be depleted during long-term laxative use, but chromium is unlikely to be affected. Zinc, copper, manganese, and selenium are also not generally impacted by normal laxative use. Which of the following foods is highest in vitamin K? A. Sweet potatoes. B. Dark leafy greens. C. Pumpkin. D. Beets. The answer is B. Dark leafy greens. Dark leafy greens such as kale, collard greens, and chard have among the highest levels of vitamin K of any food. The other foods listed, beets, sweet potatoes, and pumpkin all have very low vitamin K content, and are safe for a patient on a warfarin diet. Which of the following foods would be unsafe to consume for a patient taking atorvastatin? A. Orange juice. B. Fish. C. Grapefruit. D. Dark leafy greens. The answer is C. Grapefruit. Grapefruit can decrease the activity of cytochrome P450, one of the body's most important detoxification pathways, by as much as 30%. Consumption of grapefruit while on certain medications, including atorvastatin, can lead to toxic levels of the drug. All other foods listed are safe for patients to consume while taking atorvastatin.